Peace be to you all. Assalamu alaikum. Omar here, physician associate and doctor of health education. So very briefly, I wanted to tell you all about the physician assistant national certification exam. That's the exam that usually physician assistant new graduates have to pass in order to get their certification. Experienced PAs like me have got to take the physician assistant recertification exam, the PANRE. I use a couple of different resources to study for the exam. If you're like me and you're a PA who's working now, you're in a time crunch. You know, we don't always have time to take off weeks from work to study. A lot of us are entrenched in our specialties and have been so for years. I'm a hospitalist PA. I've really been practicing internal medicine for all of my PA career, so almost 25 years now. I don't do pediatrics. I don't do surgery. It's all adult medicine. So there's things that I need to review that I've since forgotten. Things like the Denver developmental chart. Can't even say it. That's from pediatrics. Tanner's, that again from pediatrics. OBGYN. So a lot of those types of things. My advice to you guys would be to stick with items that you know or resources with which you are familiar. Let me show you this book. Forgive the shaky cam. That's my table. I hope the lighting is okay. I hope you can see this here. These are just some of the review books that are out there. There's the Pearls of Wisdom. This is I don't even know who this is by. There is the what else? Appleton and Lang. This is an old edition of Appleton and Lang for the physician assistant review. Physician assistant review by Patrick and Morris Kirstein. I don't know if you can see that. And what else do we have? This is Kaplan Medical. This is again yet another PANCE book. Now, what I do is I've always used these books. This book by this is the comprehensive review for the certification and recertification examinations for physician assistants. This is by lighting's terrible. I hope you guys can see that. The original one was by Claire Babcock O'Connell and Sarah Zarbach. This is my second edition from years ago. Again, the light is probably messing that up. And this is the fourth edition. And I recently purchased the seventh edition. Lighting. Okay. Yeah. So you should be able to see that. And that has 17 chapters in it. And the 17 chapters they go by, they follow the blueprint. So the blueprint can be seen on the NCCPA website. So it's the National Certification. I forgot what that stood for. That's the National Certification for National Commission on Certification of Physician Assistants. That's crazy. There's so many abbreviations and different organizations in the PA field. So you look at these things like, what is the AAPA? What does JAAPA stand for? What does APA stand for? What is NCCPA? So it's just a lot of them, and it's easy to forget if you don't use them all the time. But anyway, on the National Commission for the Certification of Physician Assistants, now we're called Physician Associates, on their website they have something called the blueprint, and the blueprint is the outline for the PANCE exam, or the PANRE exam. And again, I think the lighting is kind of messed up here. I don't know if you guys can actually make that out. That's terrible. Maybe I can do some editing or something. But it'll show you each system that's on the exam. So there's things like, you should know that the cardiovascular system comprises most of the exam at 13%. And then it goes down to dermatologic system, that's 5%. Endocrine is 7%. Eyes, ears, nose, and throat is 7%. GI system is 9%. Genital urinary is 5%. Hematological system is 5%. Infectious disease is 6%. Musculoskeletal is 8%. Neurologic system is 7%. Psychiatry and behavioral science is 6%. Pulmonary system is 10%. So you need to be well versed in that. The renal system is only 5%. And reproductive system is 7%. Then there's task categories, so things that you should know how to do as a clinician. So history taking and performing physical exams, that's 17%. Using diagnostic and laboratory studies at 12%. Formulating the most likely diagnosis. So you may have had a class called differential diagnosis. I got pretty good at this. That's 18%. Health maintenance, patient education, that's 10%. Clinical intervention, in other words, how would you treat this patient? That's 14%. Pharmaceutical therapeutics, so that's your medications. What medications would you prescribe? 14%. Applying basic scientific concepts, 10%. And professional practice is 5%. So if you use this breakdown in conjunction with your blueprint and in conjunction with O'Connell and what is this, Cogan-Drew's book, you should do fairly well. I personally use this book because it was endorsed by the AAPA, so it's the American Academy of Physician Associates. I've called myself a physician assistant for more than 20 years, so it's difficult for me to say physician associate. And then the PAEA, that's the Physician Associate Education Society or something like that. So you can if you follow this and then follow the blueprint, you should do fairly well. The exam is not designed to trick you, but it should challenge you. There's the option of doing the Panry LA, which was a lot of my colleagues chose to do that, but it's a long exam and it's open book. I didn't want to be spending a year to take an exam. I want to go into the testing center and take it. It's 300 questions. I want to take it and get it over with. And I don't have time to be answering a bunch of questions and trying to work. I'm at 2 different hospitals as a hospitalist, and I do employee health, and I'm in private practice. So I don't have time to do that. So, but I still have to study. So I'd rather study, pass the exam, and get it over with, and get my be able to keep my certification. I'm certified now. My certification runs out at the end of the year. We're now in 2024, so I'm in my 20th year. As PAs, we're supposed to we got to take this exam every 10 years. I don't want to take it, but it's part of the law of what we have to do. I also use this just for fun, like if I'm waiting in line while shopping or something like that. This is Dwayne Williams and Isaac Yakubov's Ultimate Medical Mnemonic comic book. The way I think, I'm a very visual learner, so I need like silly mnemonics to be able to remember things. I don't know if you can even see this with the lighting, but it has a lot of these things on there. Sorry about the lighting, guys. I'm not a professional YouTuber, but I'll figure this out someday. I've been on YouTube for 8 years, but I'm just a humble vlogger. So again, if you are trying to prepare for this exam, hopefully for you students or you graduating PA students, the program that you have attended has adequately prepared you for the PANCE. Even if it hasn't, you still have to study on your own and study effectively so you can pass it to get that certification so you can be a PAC. For those of you all who are new students, my suggestion would be start familiarizing yourself with the types of questions that are on the PANCE. Your knowledge will grow as you do your didactic year and then certainly on to your clinical year. But you want to start thinking clinically very quickly, because PA school is fast and you get everything fast. When I was in PA school, we did our rotations with the third and fourth year medical students, and we were expected to function on par with them. We got yelled at by the attendings and the chief residents when we didn't know stuff. So, I wish you guys the best of success in your studies and the best of success in your positive endeavors. If you have any interest in being a PA like me, feel free to reach out to me. I will leave my email in the comments section, and I'll leave the some information about these books and the NCCPA. All right, take care, guys. Peace.